Thanks, Premier. Can I also start just reflecting on how horrified I was to see anti-Semitic hate directed at community overnight. It's profoundly wrong. I also want to flag that it is incredibly destructive to the public health response. Hate directed at any community, geographically, by age cohort, by country of origin, ethnic background, language, whatever. It is destructive to the public health response. We've seen it with Islamophobia, and the reality is communities are focused on protecting themselves, their families and those around them, and we should recognise that, and there are many Victorians who are working so hard to do the right thing, and I just want to reinforce that it is incredibly destructive to vilify individuals in terms of getting to where we need to be. So I signed directions into law last night. I do want to thank everyone who's now got the difficult task ahead of abiding by all of these directions. That means observing the curfew from tonight, and tomorrow if you're an authorised worker to be travelling with your permit. It wasn't easy to make these decisions, as I said yesterday, but it was essential. We have to get ahead of this. We have to get on top of it to bring the case numbers down that remain high. A reminder of new restrictions which came into place last night. So from 9 p.m, there are really very few reasons to leave your home in Metro Melbourne. Authorised work, health and medical reasons, or in emergency circumstances. And when you come to work tomorrow, if you're an authorised worker, you'll need a permit. That's online now, so you can access that at the coronavirus website, and there's all the information there about what you need to do in order to generate that permit. We've made further changes to make it clear that exercise isn't an opportunity to socialise in large groups, and that taking your mask off isn't an opportunity for social drinking. Playgrounds are closed. Again, a difficult decision. It affects my family. It affects thousands and thousands of families across Melbourne. But as I said yesterday, the reality is there's a risk of transmission in those settings. 50 of our current cases, active cases in Victoria, are under the age of 10. We've seen child-to-child transmission throughout this outbreak in schools, in other circumstances. It happens very quickly in households between children. And we are investigating a potential transmission in a playground. It's not definitive, and maybe we'll not be able to make it definitive, but it looks like there's been transmission in a playground. We've also seen transmission between students who were not in classes together, who did not have any other face-to-face interaction other than sharing a walk home. Didn't play together, don't live together, didn't have classes together. Shared an outdoor walk home and transmitted between them. That is more definitive. So the risk is there. We want to minimise every single opportunity in order to get ahead of this. On wastewater, we are continuing to see wastewater detections across Victoria. They're not definitive proof that there are cases there, but it is a potential early signal, and it was a signal that we saw at 480 Lygon Street that we were able to act on early. And so it was really important to be able to prompt people to test by virtue of that. So we want the same message for these suburbs, the Sunshine West industrial area in particular, and we're reaching into those industries in order to facilitate testing. So please step up to get tested if you're working within that area. The Burundara area continues to ping. Again, no cases identified there, but please bear in mind, if you're symptomatic, we want you to step forward for testing. And the Truganina Williams Landing area are all showing repeat positive and unexpected detections. There's also been a repeat wastewater detection in Shepparton. Again, not definitive of a case being there, but in particular I want the people of Shep to consider, if they're symptomatic, to come forward for testing. If you live or work in these areas, you don't have to reside there. If you're moving into those areas, especially as an essential worker, please get tested. As the Premier said, Glenara and City of Port Phillip are also areas of concern. Kate will talk to this in more detail, but we're seeing mystery cases here. So this is a place to get tested if you're at all symptomatic, if you've been to any of those exposure sites. And there are dozens and dozens of exposure sites now in those areas, so please go to the website to understand whether you might have been to one of them. We want people to come forward for testing, so again, if you live, work or otherwise moving through those areas, please pay attention to this message. And we want more than 30,000 tests a day. We're just there. We can do a lot more. There's no reason not to go to a testing area. There is a lot of opportunities for testing sites across Metro Melbourne, and there are more that have been stood up in those local government areas in particular. So Albert Park Lake, Paran Town Hall, the Alfred, Brighton Golf Course and others. Some further away may have greater capacity. You can go more than 5 kilometres for testing purposes, so don't feel constrained by that. And visit the coronavirus website to see what the waiting times are, to see what's maybe newly opened and what the operating hours are, and come forward for testing. Thank you. I'll pass to Kate.
Thank you, Brett. Good morning.
Yeah.
Professor, could you share some of your contingency planning in terms of if lockdown fatigue has been the main reason for people flouting the rules lately, how concerned are you that the lockdown extension might not be a sufficient deterrent? And what would you think beyond that to try if that doesn't work?
Look, crystal ball gazing is probably the least productive use of our time here every day, honestly.
Planning,
we are confident that the additional measures will have an impact on the movement, on the interaction of people. So I do have confidence that it's going to be a driver that will help reduce transmission. Fatigue is real. No one argues with the point that we are fed up to the back teeth of being stuck in our homes and not being able to interact with our loved ones and our friends and family. But I think Victorians understand what's at stake here, and I think they are reflecting on how it could go and are not wanting to go to that place. So I think we'll do our utmost in reinforcing those messages, but we all have to wear the awful choices that means that we can't take a different path and expect that it will just not put us at supreme risk. I've got 2 minutes. So
in terms of what's at stake, we've had 8 females under the age of 18 die by suicide according to the latest coronial data between January and the middle and July this year. That's the highest number in 5 years. 51% increase when it comes to teenage self-harm at emergency departments. I mean, how are you preparing, or how do your rules take that into account, given this mental health emergency that we've heard so much about?
These are absolutely tragic circumstances, but I've been asked this question 100 times. It's always the same answer, that the alternative is that this goes on for longer and it's harsher, or we suffer hundreds of deaths, literally hundreds of deaths from coronavirus. And they would be deaths in families that have young people, that have grandparents, parents. There have been millions of people orphaned by coronavirus around the world. Officially, there are 4 million plus deaths. Unofficially, the estimates are over 10 million, and we're maybe halfway through this pandemic for much of the world. If there were an easy path here, we would choose it. The awful consequences of lockdown are apparent to everyone, myself maybe more than most. And if I could choose otherwise, I would choose otherwise. All I can say is that my heart breaks, so many people's hearts break at the prospect of the sadness and the despair that people experience because of the challenges of lockdown.
Patrick McCrory has called this morning for a mental health commander to stand up at these press conferences each day. Is that something we should be doing, to have a mental health professional stand up and talk to Victorians about how
I'd certainly support it. I think we need, we need the guidance, we need the messaging that tells us how best to manage in these most difficult of circumstances.
Just on that earlier point, where you were talking about if these case numbers don't drop by September 2, would you commit to, I guess, lifting the curfew and easing these new restrictions to give people some respite?
I'm not going to go to decisions
approach?
that I may or may not make 2 weeks from now.
In terms of the reality, though, we've had
Sorry, I've got to go. Thank you.
Well, let me pick up the point about a different approach. Look,